Good morning. This is Marcia, and I'm going to give you a virtual tour of the Wesleyan Hospital of Laganab. This is the chart room. And you can see all these boxes hold all the paper charts of all the people who have ever been seen at our hospital. And this is Cristo, and he meets people at this window, which is now covered with plastic because of COVID, and is the first person who greets them as they come to have their charts made and then go to see our doctors and nurses for consultation. This is the courtyard where the old hospital stands. The green building that you see in the distance is the old hospital. It has a Y shape, and the part that you see there has been turned into a COVID unit, which has just been shut down, but was the place where we saw our COVID patients. Recently, the tent you see there was part of the COVID treatments, and you can see the hand washing station there too. This is our laboratory area where patients wait to be seen in the lab. We have a very nice lab. A lot of what we receive in the way of funds to operate, about 60% we get from small fees, which are patient fees in the hospital and bonjour, bonjour, m'apmutrez-nous na itazini l'hôpital. Okay? Bonjour, comment vous êtes? And a grant that we received from JESCU, which is the HIV/AIDS program. And part of that is why we have such a very nice lab. So here's the list of laboratory tests we can do, which include hemoglobin and hematocrit, malaria testing, sickle cell testing. We can do blood typing and white blood cell count. We cannot do hepatitis testing, which is the reason that the government does not want us to give blood unless it's emergent. But many of us have given blood for patients here and appreciate the lab services. This is where patients wait for the lab, and I'm going to walk you over to where, when our patients get their charts, they will receive them up there at the window and then come past our old pharmacy building, which is now a supply storage area. And this building, which used to be our x-ray, where we dipped x-rays, and now is a break room for the staff. And then over here to the clinic where they wait to be seen for consultation. This building is kind of falling apart, and we hope in one of our next major projects to renovate it. This is Martine, one of our nurses. Bonjour, Martine. She's checking blood pressures and weighing people and checking temperatures. And then they come in here to be seen by the docs and nurses. You can tell by the ceiling that we have a few leaks. In this area, we see tuberculosis patients in our TB clinic. This is one of the consultation rooms. You can see we have an ultrasound machine here. We see prenatal clinic patients here on Tuesdays, especially new prenatal patients. We do dates with the ultrasound machine so people know when they need to come to the hospital, or if they're going to do a home delivery, which is primarily the way people deliver here, when they need to have somebody in their home to help them. We see HIV/AIDS patients in a clinic in the back area here. And we have vaccination clinics here on Tuesdays and Fridays. So this place is full of babies and moms on Tuesdays and Fridays. We could do more with patient education here on these walls, and with prenatal clinic, which we're hoping to do. We have a grant currently, and as soon as COVID restrictions pass us, we hope to be able to do that. We used to be kind of the only clinic in town. That's not so true anymore. But we still have our niche in all of these government programs that we do, and people can receive medications for TB and for HIV/AIDS and vaccinations free through us. This room is a dressing change room, and people who live out of town can stay in town somewhere and don't have to stay at the hospital to have their dressings done. They can come here daily or every other day or every third day to have their dressings changed. This part of the hospital was damaged during the earthquake and is waiting to be torn down, but it houses some electrical components that are necessary. So for now, it remains. Another view of the old hospital. To the left of it is a wing that we are preparing to be used as a temporary clinic whenever we're able to renovate the old clinic. Now I'm going to walk you down to the new hospital, which we moved into in January. I always forget if it was 2014 or 2015. I believe it was 2015 that we moved into it. And we moved into it during the evening in the dark, which is a cultural thing, because you don't want to show everyone all the things that you own, because then it would be an obligation for you to have to share them. On our way down to the new hospital is the pharmacy. Here you can see the entrance from the outside. Since COVID, we've tried to make entrances more centralized. So we'll go in through the hospital entrance. This first building is a building that's recently been put in by some donors who have built a desalination machine and are bringing it down hopefully in November. It's an exciting thing for the hospital to have a possibility of making its own clean, drinkable water. And this is the entrance to the pharmacy. It's being repainted. And I'll give you a quick look inside the pharmacy, which is pretty well stocked right now, being manned by one of our nurses. Unfortunately, most of our patients have difficulty paying for their visits and for their medications, which is the big dilemma of providing health care for the poor, in that if you're going to do it, you're going to have to figure out how to fund it other than having patients pay for it. And since there's really no insurance here, that's not an option for providing care for people here on Laganav either. And this is the other half of the building that pharmacy is in. This is Central Supply. We have a couple of guys that are provided with salaries from people outside the country. They man this area and provide supplies to the units in the hospital. Before we moved into the new hospital, we did not have a Central Supply. And when we did move in, we emptied out all the closets where donations had been stored, found some very interesting things. We also had a missionary who came down and organized all the supplies. And so we have a very nice book which tells us where everything is now. And we do not have a computer system which controls it, but at least we are able to find what we have and have somewhat of an idea of when we're running low on things. This is our new hospital. The old one had 33 beds, it was very busy all the time. This one has 44 beds. This is Surreal. He does a lot of the great painting around here. And I'm going to take you through a walkthrough. That's Pastor Berstrand. This first room we come to is the emergency room. This is one of our wonderful doctors, so she's really happy to have her here. And this is the nurses area in the emergency room, another one of our great nurses. Looks like we have 3 empty beds and 1 busy one today in the emergency room. We see a lot of motorcycle accidents, a lot of respiratory illnesses, a lot of complications of pregnancy. This room is also part of our emergency area. We call it Little Surgery. They do exams here and they do stitching, and it's an area that's really great for teaching for our doctors. We have 4 regular doctors and we also have 4 social service doctors. Social service doctors are people who have been assigned to us for the year. When they get out of medical school, they are assigned a year of free service that the government requires of them. And they, like Bob says, when he got out of medical school, they go 5 years after high school, and when they get out of medical school, like people in the States, really only know that all they know is nothing. And so when they are assigned that year of social service, They can be assigned anywhere in the country. It may be someplace where they have no one to teach them and just have to do it on their own, or they can be assigned a place like us where they have people like Dr. Ferdinand, our 73-year-old doc who's been here 37 years and does some surgery and has a lot of experience, and Dr. Robert, who are willing to teach them. So we're very glad to have them, and we're very glad to have that opportunity to send them away with some education. This is maternity. You can see the pictures on the wall. These were taken by Indiana Wesleyan University students who, up until last year, did their maternal child rotation with us. Unfortunately, because of the instability in the government, they have been unable to do that with us this past year. These pictures are all newborns or skin-to-skin early bonding pictures that they took. Looks like we don't have a lot of babies right now, a couple, but that's maternity. Either we are just pushing the limits of what we can hold, or we don't have a lot of folks. So a couple of babies right now. Bonjour, bonjour. Now we're going to walk down to labor and delivery. Like I said earlier, we see a lot of complications of pregnancy. We have a lot of high blood pressure in the population, and so we also see a lot of eclampsia and preeclampsia. We see women coming in with seizures sometimes, and we have to do cesarean sections in order to save the lives of those moms. That means we sometimes have a lot of premature infants, and unfortunately we can't do a lot for premature babies. But we can do those C-sections. Bonjour. And sometimes do enough to help the babies too. This is our surgical suite. The room on the left we use for preoperative preparation, as well as for postoperative care of patients. Regularly we do C-sections and tubal ligations for patients. And this room is our main surgical suite. It's great to have this great big space because we have a lot of learners here. We have our social service docs and our regular docs who want to learn to do surgeries. It is our policy whenever we have a surgery to at least have one Haitian learning doctor scrubbed in, whether that's an American team that's come down or our doctors here who are doing the surgeries. So right now there's several of our docs who are learning how to do C-sections or tubal ligations. We'd like to have a visiting team a week, a month. Unfortunately, during coronavirus, we've been unable to have any teams. However, we are hearing from docs who are starting to think about coming back. So hopefully by January, we'll be starting to have some teams again. We also have nursing students from the Wesleyan University, which has a 4-year nursing program. Those nursing students would like to assist with care of babies after C-sections. And we have had the nursing students from Indiana Wesleyan University who wanted to assist and also with babies and also to watch surgeries. And sometimes when we've had visiting teams, those people would like to watch surgeries as well. So we're really glad for this room. There is another suite, another surgery room like this that is a mirror image. We sometimes do small procedures like circumcisions in that room while we're doing larger ones in the main suite. Our doctors are not like doctors in some other places. They don't make a lot of money. This is our sterilization area. They make somewhere between $500 and $800 a month. And that's because we supplement what they get paid with some donations that we get from outside the country. Our staff here, we're very sorry to say, bonjour Bridget, that's Bridget, she does laundry, don't really get paid a living wage. It's very difficult for us not to be able to pay them a living wage, but like I said before, patients can't pay. So it's difficult for the hospital to make ends meet. Now I'm going to show you the wings of the hospital. We have a pediatric wing and an adult wing, and they're much the same. The pediatric wing has pediatric beds, and then private rooms on the end because we do have some patients who would like a private room, and we do offer private rooms to our staff if they're hospitalized. The adult wing has women's rooms, nurses station, and then male rooms, and then isolation rooms. The isolation rooms are often used for tuberculosis patients. We almost always have some of those. I'll walk through the pediatric wing. We don't have a lot of babies right now, which isn't a bad thing. We often see children who have waterborne illnesses. See Dr. Bob with one of our kids. And one of our preemie babies over here who is doing pretty well, and one of our nurses, mom feeding her babe over there. So, as you may have guessed, we do not have any privacy laws here. That was the peds wing. In between the two wings, right now we're growing corn. Which is kind of a cool thing, I guess. At least something is flourishing here. And this is the adult wing. This is the men's area. And up until just a little bit ago, the docs were doing rounds together here. They do rounds on, here's a couple of our docs doing charting right now, Dr. Baggio and Dr. Estep. And this is our adult women's wing. In most hospitals in Haiti, before you receive any of the treatment you get while you're in the hospital, you have to pay for it. So before you receive medications or before you receive a dressing, you pay, and then you go to the pharmacy and purchase those items, and then you bring the item back and the nurse gives it to you. Just to show you some of our challenges, this is the room where they decide how much you owe. Unfortunately, we do not do it that way. This is Michelet. He's one of the people who has to tell people how much they owe, so it's a difficult job.
Yes.
So anyway, a lot of times the hospital just has to say, okay, you've tried, and we're going to let you go home, even though you can't pay. We really appreciate him, and we'd like to duplicate him 3 or 4 times. So, and this is Obens. He is one of our central supply people. And he has lots of friends. He gets a lot of telephone calls. One last photo of a person. This is one of our nurses. And this is Madam John.
Hey, hello, babe.
She and Friend Guido are the folks who take money. And we have some great folks who we trust to work on that sort of thing. So thanks for listening and being interested. And I hope we can let you know how thankful we are for this place and for what people do here and for how persistent they are at doing it well.